Okay, so my name is Maya Ulfa, binti Mayadi, and today I will do a lower limb examination. So first, expose the patients adequately, which is until up here, up of the thighs or the hip area. Try, and then before we do anything, we need to do inspection. So in inspection, we check for any wound, any swelling of the legs, any calcification of the muscles, any facility, any deformities like any shortening of the limbs or any of the abnormalities lah. And then we move into tone, which is to check the upper segment. So tone is okay. And then we check for power and myotomes also. And then, so how we're going to do it is first, hip abduction and adduction. Ideally, we check for both, compare both immediately. So, in the right thigh, right lower limb, hip abduction, and then patient has to resist me pushing the limbs inside. So patient, okay, and then we do the same thing on the left side, hip abduction. So patient need to resist. So L1 of hip abduction is good, and the power is based on MRC is grade 5, which is against resistance and gravity. Okay, and then after that we do hip flexion, which is L2. So hip is flexed, and then hip is flexed, is extended. And then the same thing on the left side, flex, and then flex, and then extend. Okay. Again, power is 5 for both of the right and left lower limb. And then we do knee flex. So before we do knee flexion or extension, we need to flex the hip first. So that is natural. Okay, so knee flexion, which is L3, so knee is flexed. And then patient has to resist knee. Okay, patient resist. Okay, again, the same thing. And then again, we do the same thing on the left side. Hip is flexed, and then knee to be flexed. Okay, resist, and patient needs to resist that extension. Now 3 is done, and knee flexion power for both limbs are grade 5. And then we move into L4, which is the dorsiflexions of the ankle. Okay, so here, like this is the normal thing, and then so like we need to pull it down, which is plantar flexion, and then we ask patient to pull up, which is the dorsiflexion, and then we have to ask patient to resist the dorsiflexion. Again, do the same thing on both limbs, plantar flexion. So L4 and S1 is done. L5 is the picto reflex. Here, so 1, 2. That is for the myotomes, and then this is for the dermatomes. So dermatomes are divided into 6. So one is L1 here. So ideally we would like to have a wooden stick, but we don't now. So we're gonna use this. First of all, you need to make sure that your patient knows what he or she needs to feel. So what it is that, okay, patient, look, this is the wooden stick that I'm gonna touch on you. Okay, so this is the wooden stick, for example. Okay, can you feel? Yes. Okay, is it sharp or blunt? Sharp. Okay, and then we move on the leg. We always compare both limbs together. Remember that. Okay, so L1 is inside of the thigh. So patient, please close your eyes. Okay, here, can you feel? Yes. Sharp or blunt? Blunt. Sharp. Okay, and then we do on the left side again. Side here. Can you feel? Yes. Sharp or blunt? Sharp. Okay, and then we move inside here, which is L2 inside here. L2 inside here. Okay, we feel, again we ask the patient, be keep it short, like that. You remember to use the sharp tip. Do not use here because then it will be blunt for the patient. Sharp tip, and then L3 is here, so we use the medial side of the knee, like that. Again, we ask the patient. L4 is in the inside here, okay, and then we ask the patient. Always ask the patient before you move here. So like, is it patient, can you feel? Patient, can you feel? Okay. And then L5 is here. So ideally we use the first web of the dorsal of the foot. So here, and then here, and then we move at the back, plantar. Remember to use the soft side. Do not use this hard area or the weight bearing area, because then you get a false positive lah. Okay, here and then here. So that is for the dermatomes. Now we move to the peripheral nerve. It's only have 4. One is the obturator nerve here, or you can use L1 for easy understanding. Okay, here is obturator in the thigh. Here, obturator nerve. Here, obturator nerve. Remember to do it on the skin, not on the clothes. Okay, I cannot properly expose the patient, so here, like here. Okay, and then femoral here area. Okay, we move here and then here, L2, and then the sciatic nerve, which is at the posterior of the limb. So basically this whole back is sciatic nerve. However, sciatic nerve is only on the thigh, and then it's divided into tibial nerve, this whole back. So sciatic nerve divided into tibial nerve and then common peroneal nerve. So how are we going to use that? Is that we just check for tibial nerve, which is here at the soft area, and common peroneal nerve. So that is for sciatic nerve. Again, please do on both sides. Okay, thank you.